Okay, hi, Paul Sakis, Good News Broadcast, Good News Planet, and actually Pause the World for Peace. And we're going to talk about the Huntington's disease, concerning disease of which 41,000 adults currently are affected in the United States. Another 200,000 people are at risk. So that's kind of a serious number here. And that risk means that they don't know about it or what? I have no idea. And we're going to talk about chorea. And I don't know much about that as well. So we're very honored to have two people that do know what they're talking about here. And we have Dr. Erin Furr-Stimming. Hi, doctor. How are you this morning?
Hi, I'm good. Thank you so much for having me this morning.
Okay, and we have an expert in the field along with that's what the doctor is. I imagine Katie knows a lot about this as well. Katie Jackson, you're an advocate with HD. Do you have HD or do you know people that have HD? What makes you an advocate?
So my husband passed away. My husband was diagnosed with Huntington's disease at 24 years old, and he passed away at 41 after a long battle. And I have 3 children at risk.
Oh, jeepers creepers. Okay, doctor, what is Huntington's disease? Let's start there.
Yeah, so Huntington's disease is a devastating inherited neurologic disease. Huntington's disease causes breakdown of neurons or nerve cells in the brain and leads to cognitive, motor, and psychiatric symptoms. The most common motor symptom is chorea, and chorea is defined as an involuntary, uncontrollable movement that can make everyday tasks for most of us almost impossible. As you mentioned, there are over 200,000 individuals living at risk for Huntington's disease, which means that they have an affected parent. And the mode of inheritance is autosomal dominant. So each child has a 50% chance of inheriting the Huntington's gene mutation.
That's really amazing. And so, do we know how it happens, why it happens initially?
So great question. So we know that individuals with Huntington's disease are born with the mutation. However, they don't become symptomatic until the prime of their life, often after they've had children. We don't know exactly why folks become symptomatic when they become symptomatic, but we know that folks can have psychiatric symptoms and cognitive symptoms up to a decade before they have obvious chorea. The chorea, like as I mentioned, can be incredibly difficult, make it incredibly challenging for individuals to perform day-to-day tasks, and can lead to frequent falls and difficulty with mobility.
Okay, let me ask Katie. Katie, did your husband come from a family that had HD?
He did, but we didn't know. So he was estranged from his father when he was very young. 6 years old was the last time he saw him. And it was kind of talked about that his family was crazy. I didn't know why. We found out from a call from a mortuary that his biological father had died from something called Huntington's disease. My husband was a sheriff at the time and working. We were in the prime of our life, like Dr. Erin Stemming said, and he decided he wanted to be tested. And he did, in fact, test positive. And looking back, he already had symptoms of Huntington's disease for a long time. We just didn't know. I thought they were mannerisms or behaviors, his movements.
Wow, this is obviously has been devastating. How have you been advocating? And thank you for doing that.
Yeah, so I actually am CEO and president of a nonprofit organization called Help for HD International, and but there are great, amazing organizations out there to help families with Huntington's disease. There's HDSA and HDYO, HSG. So if you are a Huntington's family, although we do not have any drugs to slow down the progression of the disease or cure the disease, there is support and resources. So please find us so we can help you along the way of this very, very horrible journey that you are going to have to go on. There is support and love out there for you. And thank you to Neurocrine Biosciences for giving me the opportunity to talk to you about this today.
Uh-huh. Doctor, would somebody that had a family that had this disease and concern, wouldn't, I guess, as soon as they were a baby born, is this something that, or it's too early on to look into it and say, you have the same. I mean, I worked on a series called The Brain many years ago, PBS in '82, and the PET scans. There's things out there that it can tell us, especially today. This is '82, is a long time ago. So is there ways to discover concerns?
Right. So the mutation was actually identified in 1993 in Maracaibo, Venezuela. There were scientists that traveled regularly to learn more about Huntington's disease. There's a high prevalence of Huntington's disease actually in Venezuela. So we've been able to perform genetic testing since the early 90s. And so individuals that are at risk can pursue genetic testing, predictive or confirmatory genetic testing. However, it's imperative that they visit with a genetic counselor prior to moving forward with genetic testing. We generally discourage folks under the age of 18 from getting tested unless they are symptomatic. There are kids that become symptomatic, but juvenile Huntington's disease is rare and rarer than adult onset Huntington's disease. But we're so grateful that you're giving us the opportunity to talk about this, to raise awareness so that we can have these conversations and get folks evaluated by a Huntington's disease team and ensure that they get plugged in with organizations like Katie's organization and others that she mentioned to make sure that they are as well informed as possible about this devastating disease and the treatment options available.
Yeah, that's what I was going to ask. Are there treatment options available?
So we don't yet have a cure, as Katie mentioned. However, we do have effective symptomatic medications. We have medications that we can use to treat most of the symptoms of HD. We have now 3 medications that are FDA approved for Huntington's related chorea. The most recent approval was of valbenazine or Ingrezza, and that occurred in August of this year, based on the results of 2 clinical trials, the Connect HD and the Connect HD2 clinical trials. And I'd love to tell you more about it if we have time.
I have time if you have time.
Amazing. So as I mentioned, valbenazine was approved based on these 2 trials. So the Connect HD2 trial is an ongoing open label trial. The Connect HD trial was a phase 3 clinical trial that enrolled 128 participants and evaluated the safety and efficacy of valbenazine versus placebo in treating Huntington's related chorea over a 12-week period. And the results of that trial were favorable. In fact, we did demonstrate that individuals that took valbenazine had a 3 times greater improvement in their chorea versus those that took placebo. And we saw that improvement early on, actually at 2 weeks at the lowest, at the starting dose, which was 40 milligrams. So we celebrate the results of this trial. We celebrate the approval of yet another VMAT2 inhibitor. However, we must be respectful of the side effects that all medications have, but in this case, valbenazine. The most common side effects in the trial were sleepiness, allergic itching, rash, and trouble falling asleep. There's also, importantly, a boxed warning surrounding valbenazine and the other 2 approved VMAT2 inhibitors. And this warns us for the possibility of an increase in depression and suicidal actions and behavior. Unfortunately, suicidality and depression are far more common in Huntington's disease than the general population. So it's really imperative that we have these discussions with our patients prior to prescribing valbenazine or any other medication for that matter.
Let me go back to one thing that we had here. 200,000 are at risk. Okay, so how does somebody know that they're at risk, and what are some of the signs that somebody in a family could notice and or friends, whatever? Where are those 200,000? That's a serious amount of people.
You're exactly right. And so, as I mentioned, Huntington's disease is hereditary. So most individuals know that they have an affected parent and therefore know they're at risk. Not all individuals. As we heard from Katie, that wasn't the case with her husband. So the common psychiatric symptoms are, as I mentioned, depression, anxiety, irritability, apathy, or a lack of motivation. The common cognitive symptoms are trouble with attention, focus, trouble with making decisions. And then, as I mentioned, chorea is the most common motor symptom, which is an involuntary movement. However, it's not the only motor symptom. Patients can have trouble with balance and coordination, trouble with mobility. So we know that it's a slowly progressive disease, and patients can be symptomatic for many years before we actually make a clinical diagnosis. But if patients have a known family history, that's the first clue. If in fact they're experiencing some concerning symptoms, that they should visit with their provider to talk more about Huntington's disease.
Katie, how does a family stay together under this kind of a condition? It's a big question.
You know, Yeah, I really think finding your support and finding is so important dealing with this disease. I felt very alone in the beginning of this disease. I had 3 children at risk. And even now, even running this organization, my children are coming to the age of testing and they're talking about testing. And I really lean on my Huntington's disease community for that, to get me through those days that I'm scared and I'm losing sleep. I can only imagine how my children feel through this journey. We talk all the time. So communication is so important. Talking to your children, talking to your community, talking with your family about how you want your journey to look like and how you want to be supported, is so important.
Okay, once again, is there a website that we can send people to, or where should we go?
Yes, absolutely. Absolutely. So I'll let you go first, Dr. Stemming, and then I
So
can
if you want to
follow up.
learn more about valbenazine, the newly approved drug, you can go to ingrezza.com, and then I'll defer to Katie to talk about the awesome resources underway.
Yeah, so Help for HD International, you can find us at help4hd.org. And we have so many resources for families. There's other organizations out there that are great, HDSA, HDYO, HSG. But please find us, and we would love to support you and stand by your side through this journey.
Okay, congratulations for coming out to do that. Very brave of you, and thank you very much, Doctor.
Thank you.
Speak to you soon.
Thank you so much for having us.
Okay, take care. Bye-bye.
Take care.
Thank you.